Hi, I'm Alison from Newcastle Speech Pathology, and I'm back chatting with Rhiannon from Ability Focus Occupational Therapy. Now, Rhiannon, something that our clients often share, we share clients, but one of the situations we see is that a child particularly has some sort of sensory challenges. So I just wondered if you could just give us a little bit of a rundown as to what that might look like and answer the question, what is a sensory diet?
Sure, that's a good question. It's a very popular question. So sensory processing is very complex, and it's a neurological product where the brain and the body, or the nerve and the nervous system, isn't talking to each other very well. And so the brain might perceive danger when there is in fact no danger. So that feeling that a spider's crawling on your skin and your brain goes, get it off. Children sometimes can have that response to stimuli that isn't a spider. It might be their t-shirt on their body or socks on their feet, but their brain will fire off that response anyway. And so sensory processing is the ability to function very well, filter in all of the information coming in and respond appropriately. So for example, we've got noise going on outside, but we're not paying attention to it because our brain knows it's not important. Children that struggle with processing sensory information, maybe in the classroom, will be tuning into all of the sounds around them, but they can't focus on the teacher's sound, which is the sound that is important at that time. They can't filter out all of the things that visually are in the room. They can't process their body appropriately, so they're fidgeting all the time. So it's very complex, and because it's so complex, it looks very different in all different children. And so our job as professionals is to try and determine what is sensory and what might be something else going on.
Fantastic. So explain to me about the
sensory diets. So sensory diets come about to help children with those difficulties. And so people talk about a diet, and I guess the diet word is because it's what you're feeding your sensory system. And so that can look like things such as weighted objects to help give what we call proprioceptive feedback, which is basically a fancy word for deep pressure into your body to help the brain process where your body is. And proprioceptive input is very calming on children. So other diet objects may be therapy, again to give them that feedback. Oral motor toys such as chews, yes, for deep pressure in the jaw. So a sensory diet is not a one thing fits all. Yeah. So it should be very specifically tailored to that individual child for their individual needs. And that sensory diet may change from home to school. So your child's sensory diet may look like one thing at school and a totally different thing at home because the sensory inputs are different and their responses are different. So a sensory diet is a description for tools and strategies to help a child regulate and calm.
Fantastic, that's such a great explanation, and I'm sure that's answered quite a few questions that we had too. So thank you for watching, and stay tuned for more fantastic advice from Rhiannon.